evening for this very informative presentation. Wanted to start with a few introductions. My name is Laura Moreno, and I am from Balfour Central Park campus. We are in the heart of the Central Park neighborhood. We offer assisted living and memory care. And I wanted to say too, talk a little bit about Balfour Senior Living. We are a family of communities. We offer a variety of options, including independent living, assisted living, memory care, and skilled nursing, which is on our Louisville campus. We have locations throughout Colorado, a community in Ann Arbor, Michigan, and 2 new communities, I'm excited to say, in development in Brookline, Massachusetts, and Palisades, DC. I would like to take this opportunity to introduce Janette Allen, who is the Vice President of Health and Wellness for Balfour.
Hello, everybody. I can't see my camera. Is it on?
Yep.
Nice. Thank you so much, everybody, for joining. Great to see such a wonderful crowd. And I'm thrilled that you are all joining us. Dr. Anderson has a wonderful presentation prepared. And Laura, great introduction to Balfour and the services we offer. Thank you.
I would also at this time like to introduce Kim Paul of Synergy Home Care, one of our valued partners.
Hello, everyone. I'm Kim Paul with Synergy Home Care, and we offer what's considered non-medical in-home care, and it's helping with activities of daily living. It can be anything from preventing someone from falling to transportation, light housekeeping, and one-on-one personal care. We work very closely with the Balfour team to really help current residents or prospective residents so that they are safe and healthy in their homes, wherever that might be. And we're a national franchise, but we have 5 franchises in the Colorado Front Range area. So mostly where you are, we can get to you. And I'm Kim Paul with Synergy Home Care. Thank you and welcome, everyone.
Thank you so much, Kim. Well, at this point, I would like to turn the floor over to Dr. Danielle Anderson of Bloom Healthcare, another very, very valued partner. Dr. Anderson, it's an honor to have you, and thank you.
Yeah, thank you very much, Laura. I'm very happy to join all of you to talk tonight about dementia. So like Laura has mentioned, I'm Dr. Danielle Anderson. I'm our Chief Medical Officer at Bloom Healthcare. And we're a team of physicians, nurse practitioners, and physician assistants who visit our patients in their home setting. So we're delivering primary care that you would get in a typical office setting. We're delivering that care right there in the comfort of your own home. Tonight, we're going to talk about dementia and the brain. And this is a very important topic for all of us who, all of us are aging. And as we age, our brain changes as well. So let's, if you can go to the next slide. So we're going to talk tonight, how does the brain work? What happens to the brain as we age? And when does normal aging become dementia, a disease process that's abnormal? Next slide, please. So if we look at a computer analogy, the brain is working as like a processor, so it's your reasoning. So that's developed at an early age, and it reaches its maximum speed at around age 20. And after that time, our brains slow down in the ability to grab those memories and process, if you will. The memory, that's your hard drive. So we begin developing those lasting memories around age 3. And those memories accumulate over time, much like taking notes in a notebook. And we're accumulating that data as we grow older and hopefully wiser. Next slide, please. So my patients will often say, gosh, I'm noticing a change in the way that my brain works. I'm just not as quick as I was when I was 20. And, is this normal? And doc, do I have that dementia that they talk about? So let's talk about what happens as we age. So next slide.
Recording.
Woo.
Dr. Anderson, you'll have to unmute. Sorry about that.
Okay. Yep. No problem.
There we go. All right.
So as we age, the processor piece of our brain slows, as I've mentioned, and it slows at a continual rate, right? So as we age, our ability to grab those memories becomes slower. Our ability to quickly come up with solutions is slower, but we still retain that ability to remember and to process things. It's just slower. At some point in the normal process of aging, that change can become at a level that is noticeable, where it's not really limiting our ability to be independent or to function, but it is noticeable such that we call it mild cognitive impairment. Unless it's there for decades, it's not going to affect our ability to function. It just slows it down. We won't be as quick as we used to be. And you'll see that too in reflex response, the time that it takes to complete reasoning tasks, and the time it takes to recall certain memories. And again, this is natural, and the progression of this change is very slow. Next slide. So if we graph out cognitive function over time, this graph depicts, and it may be hard to see depending on your view, but there's a line here. This line is showing the speed and the ability of our brain to quickly come up with those memories. And as you can see, it peaks out at around age 20. And then over time, it slowly declines in its quickness of grabbing those memories. And you'll see a red line there, and that's depicting an abnormal process, something very different from normal aging. That red line is representing what occurs with dementia, where this is not a normal process of aging, and the cognitive decline is such that it can be marked. It can be limiting in our ability to function independently. Next slide. So dementia is not normal. Dementia is denoting something has happened to the ability of the brain to function. Next slide. So dementia is this umbrella term. It's not a disease itself. It is a description of what's happening with brain function, but it doesn't tell you why or what's happening. So again, the umbrella term is dementia, and we'll describe the pathological processes with diagnoses. So go to the next slide, please. So this lists the most common types of dementia. Alzheimer's disease is at the top of the list. Alzheimer's dementia is the most common type of dementia that we see. Vascular accounts for the second most frequent type. you'll see that I have mixed dementia on this list as well, because often there's overlap. Parkinson's disease has a related dementia that some people with Parkinson's disease will go on to display. Frontotemporal dementia, Lewy body dementia, and alcohol-related dementia are all on this list of the most common types. And you'll notice—
What is vascular dementia?
Yeah, so we will go over the different types of dementia. Vascular dementia is a type of dementia where the blood flow to the brain is disrupted for a number of reasons, a number of possible reasons. And that can create damage to the brain that creates that dementia process. And we'll talk specifically about those. Next slide, please. So you notice that those numbers didn't, they exceeded 100 because of all of that overlap. And then I mentioned here too, the fastest way to get an Alzheimer's dementia is to have a stroke. So a stroke can cause damage to the brain that predisposes one to an Alzheimer's type dementia. And I see hydrocephalus. Yes, hydrocephalus is an entity. It can be associated with dementia, might not be causative, it depends. But hydrocephalus is where the ventricles of the brain, their structures that house fluid, those ventricles may, because of a couple of different things, can be going on. So you can get increased volume because of atrophy of the brain. So shrinking of the brain in one area can create this atrophy. The other thing is what we call normal pressure hydrocephalus. So there can be pathology going on in the brain that creates more volume in those ventricles. So that is a cause. We don't talk about it here. It's not as common as those other entities that I've mentioned. Next slide. So we're going to talk now about the different types of dementia, and I'll go through the dementias on that list, and then at the last, I'll save Alzheimer's dementia as the last type of dementia we'll speak about. It's the most common. But let's talk about the types of dementia that occur less frequently first. So vascular dementia, as I've mentioned, there is an issue with blood flow to the brain. Most of the time that is due to atherosclerosis. So that hardening of the arteries that can cause critical blood flow issues to your heart and cause a heart attack. That kind of process can go on in the blood vessels that supply the brain, and that can cause stroke, and that also can cause small events that go undetected day to day that create brain damage because of ischemic events. And when I say ischemic events, I'm meaning lack of blood flow to the brain such that brain tissue can die. So you get tiny little damage that may go undetected. And so a common type of vascular dementia is microvascular changes. So the tiny little blood vessels become damaged, often due to atherosclerosis, and you get small hits to the brain. And depending on where those hits are to the brain, depending on where that damage is within the brain, is you'll manifest the changes differently, just depending on where in the brain is affected. I mentioned transient ischemic attacks as well. Transient ischemic attacks, or TIAs, are by definition transient, and reversible. That being said, if you've had a transient ischemic attack, it is likely that the blood flow to your brain that was transiently disrupted is being disrupted on a smaller scale in other vessels. So if you've got this setup for a transient event, you probably have some issues with the blood flow to your brain. And the way to help prevent vascular dementia is to do those things that would decrease your risk of stroke. And we'll talk about that a little later. The way, and I'll just say one other thing about vascular dementia before we move on. The way that this looks, the way vascular dementia looks, like I mentioned, it's unpredictable because we're not certain where in the brain is going to be affected. So it can look very different, and it may progress if you've got a atherosclerosis that is, getting worse with time, as atherosclerosis typically does. It may progress at with some randomness as well. So not patterned, clinical course. Next slide, please. Parkinson's dementia is worthy of discussion. About 15 to 20% of patients with Parkinson's disease who have Parkinson's disease for years may develop Parkinson's-related dementias. It's a late stage finding in that entity, but not everybody with Parkinson's will get it. It's actually pretty common for those with Parkinson's disease to actually have coincident Alzheimer's type dementia because it's just much more common. People with Parkinson's related dementia may benefit from some of the same Alzheimer's type treatments that we'll discuss later. Next slide.
Okay.
Lewy body dementia is another type of progressive dementia. Its hallmark is waxing and waning of cognition. People with Lewy body dementia are often diagnosed early on with Parkinson's disease because this type of dementia also has some muscle rigidity and slowed movement, possibly tremors, that looks very similar to Parkinson's disease. Early on, those findings may clue them in, like, oh, this looks like Parkinson's disease, but later we see a more prominent cognitive impairment, fluctuations in alertness and attention, possibly behavioral issues, often stemming from hallucinations, delusions, paranoia. And then this waxing and waning, people can look pretty intact and function well. And then all of a sudden, it's 2 a.m. They think the husband sleeping next to them is an intruder, and they're having an event of the spell of confusion. They don't know who husband is. So that hallmark of waxing and waning, it can be because of these movement disorders associated with it. It can be misdiagnosed as Parkinson's dementia without knowledge of the clinical progression here. So, that if you've got early onset or early in your disease process, having problems with the muscle rigidity, slowed movement, and tremors, and then cognition and those the issues surrounding memory and spells, behavioral issues are more prominent and worrisome. Often that's a Lewy body dementia that had the movement pieces displayed early on and not actually Parkinson's disease. Next slide. Frontal lobe dementia is a dementia where those particular locations of the brain are more affected by the disease. It's associated with personality, behavior, and possibly language issues. These parts of the lobe, these lobes of the brain may shrink. Another name for that is atrophy. And the signs and symptoms will vary depending on the portion of the brain affected. Those that have prominent damage in the frontal lobes, it's the personality and social ability to interact socially that that may be affected more. Folks may have problems with impulsivity, and maybe be emotionally indifferent. Others with this type of dementia are more prominent in the where it's more prominent in the temporal lobes. Those individuals may have more language issues. They may lose their ability to use language and sometimes understand language. And then you can get the two together, where you're manifesting both the personality changes and the language issues. It can be misdiagnosed as a psychiatric problem or as Alzheimer's disease. One thing that kind of clues us in is this entity tends to happen earlier on in earlier ages. Next slide. Alcohol-related dementia is another entity worthy of discussion. Unfortunately, alcohol can be toxic to the brain cells, and this can cause damage to the brain that can be gradual and progress slowly, and it sometimes can mimic depression. The hallmark of this type of dementia is this symptom of confabulation. So confabulation is really your brain's way of filling in the gaps. And I have a patient that at my first interaction with him, he was able to tell me a lot about his medical history and his background, and he was telling me all about his history as a merchant marine. And so it was a 45-minute encounter. He was this history of having been a merchant marine came back in this conversation. It was a very plausible story, and it wasn't just a moment in time. It was kind of weaved in with the stories of our encounter. And then I spoke to his daughter, said, "Oh, that's I mentioned he was telling me about his time as a merchant marine, and she says, "Oh, that's a new one. That's a new one. That's he was an accountant." So yeah, sometimes Dad has a way of believing what he has in his head, and this is not something that people do on purpose. It's just the brain's way. It's so fascinating how the brain works and tries to fill in gaps. And in this case, it was a very complex and rich story that was very plausible. So an interesting entity, and very sad, because this is something that after alcohol takes its effect on the brain cells, there's not any way for us to get that back. Next slide. So let's now talk about Alzheimer's type dementia. this type of dementia is a distinct entity, and it is a little easier in terms of its clinical progression to predict. In one of the analogies that my colleague Dr. Lally, he has mentioned before, and this really spoke to me, and has been a tool to describe what's happening with this type of dementia. You can think of it as a notebook and pencil. So your memory is, when you're born, it's like writing in a notebook. And so when you're born, you're writing down information about how to hold your head up and those stages of development, how to crawl and walk and talk, and you're forming memories like where you went to elementary school, the house that you grew up in, memories about events that happened in early childhood, in middle school, high school, if you went to high school, and college, etc., who you married, your children. So you're writing down all these memories. And the first thing in Alzheimer's type dementia to go is that lead in your pencil. So sometimes you're able to get things down in your book. Other times, maybe that lead isn't so sharp, and you can't get those memories down. The next thing is not being able to use that pencil at all. The next thing to occur with this type of dementia is that the pages in your book, you start to lose them. You're ripping those pages out, starting with the most recent. So things like, what you ate for breakfast, hard to remember that. But where you grew up and the house that you lived in, very, very clear, oftentimes. So, and similarly, you can lose your ability to perform, those instrumental activities of daily living, like, balancing your checkbook, doing things like shopping and figuring out what you need to shop and cook and those kinds of things, much harder now. And as you're losing those pages out of your book, you're also at the later stages of the disease. People with very severe dementia will forget how to do basic things like toilet, and be able to dress themselves, etc. They look at the shirt and they're not certain how to put it on, that you have to, first unbutton the buttons and then put your arm in, like those steps. They lost that. So you're losing in a similar the backward progression of development. Next slide. So why is this happening? What is going on in the brain? And I can tell you that we don't really have a firm handle on this. I list out a whole bunch of biochemical things that are happening in the brain that are associated with Alzheimer's disease. We're not certain what happens first, if one thing leads to the other, or the other thing is what causes the first. So it's been a very difficult journey for scientists to figure out what we can do to prevent and reverse the progression of Alzheimer's disease. Next slide. So the list of things that I've mentioned are just a handful of issues that we think are causing this neurofibratory tangles and these beta amyloid plaques. These plaques and tangles lead to damage of those neurons, those brain cells, and those connections. And over time, these plaques and tangles build and create more issues with our brain's ability to function. Next slide. So we'll talk a little bit about, as I've mentioned, there's the biophysiological things that are happening behind it, very complex. Next slide. And we're seeing the prevalence increase, and part of that is because life expectancy is increasing. So if you think about it, your heart, as you age, decreases its function. I can't exercise in the same way that I could 20 years ago. And my brain isn't as quick as it was 20 years ago as well. And if I live long enough, my brain is not going to function as well down the road either. And neither is my heart. And hopefully, I won't be in that proportion of people that develop this Alzheimer's type dementia or other dementias. But I suspect if we all live long enough, we would get a dementia. If we all live long enough, our heart would not be able to function, and we would get that heart failure. So the prevalence is increasing because of mainly because our life expectancy and our ability to keep this heart function very well is improved, and our ability to affect much change with the brain has not. Next slide. What can we do to avoid it? So there's a number of things, and I've got them listed out later. But to summarize, exercise, keeping our body as healthy as possible, will keep our brain as healthy as possible. Making sure we live a healthy lifestyle, eating well, and taking care of our chronic conditions, like high blood pressure and diabetes. All of these health risks, if we can mitigate those, we're going to decrease our risk of getting a dementia. Next slide. So how is Alzheimer's dementia and these other dementias diagnosed? These are largely clinical diagnoses based on the snapshot of what the deficits are in our patients, but also that progression over time. What was noticed first? How did it change over time? Did you wake up one morning and all of a sudden couldn't, do this task or that task, or was it more gradual? All of these clinical clues will help us determine the type of dementia. They are certainly looking for ways of objectively obtaining blood tests, maybe cerebral spinal fluid tests, imaging studies. But at this time, there's not a great way to diagnose beyond our clinical judgment. After death, we can do brain biopsies and look under the microscope and see what the pathology was. That's not often done, although some people have donated their bodies to science to investigate this further. Next slide. So our 2-question test, this is like boiling it down to as simple as possible. But this 2-question test. What is your birthday and what's the date today? A patient with Alzheimer's disease who is in the middle of their progression of the disease might not know today's date, but gosh, they know their birthday. That's something really early in their book that was written down. So that's kind of a quick and dirty way of seeing, is this an Alzheimer's disease? Obviously, there's a lot more questions to parcel out, but this is the quick one. Next slide. So what are our treatment options? I wish I could say that we've got good treatments for Alzheimer's dementia. We have some medicines that might help. There's a certain subset of people that will benefit from acetylcholinesterase inhibitors or NMDA receptor antagonists. You may know them as like Aricept, Namenda, Exelon. Those medications may help, but by and large, most people aren't going to see much benefit from the medicines that we have. Those medicines target one thing in that list of things that are going wrong. Might help, and a certain subset will know, like they take the medicine and they know they have a response. Others, it's not so distinct. The rule of thumb now is we try these medicines for 4 to 8 weeks, and if the patient or the people around the patient see a clear benefit, we continue them. If people are unsure or they don't see an effect, we do not continue them. The risk isn't worth the benefit. Physical exercise is definitely something that can help help slow progression, and certainly can be a factor that decreases risk of getting Alzheimer's dementia to begin with. But if you have Alzheimer's dementia, physical and mental exercise can help slow the progression. And then don't have a stroke. And obviously, there's a lot of things outside of our hands, but the lifestyle changes that decrease our risk for a stroke, that's something that we might be able to change. So not smoking, drinking in moderation, keeping our blood pressure under good control, those kind of things can help us decrease risk. Next slide. So people ask me, will I die of Alzheimer's disease? Is it terminal? In Alzheimer's disease, while it does affect your brain and ability to function, it isn't a cause of death, although it does create situations that don't allow the body to protect itself. So people with late stage Alzheimer's disease may have mobility issues that predispose them to pressure ulcers and infections of the bladder because of difficulty with toileting and issues surrounding that. It also predisposes to problems swallowing or having the appetite to eat. So becoming malnourished and these things will lead to death. And so unfortunately with Alzheimer's disease, it's a slow, the disease progresses slowly. It isn't the cause of death in and of itself. It's the things that it causes that create situations that put those people at risk. The other thing that I get asked is, if my mom had Alzheimer's, does that mean I'll get it? Now, we do know that there is some genetic predisposition in certain like ApoE mutations, and there are genetic markers that predict risk, increased risk, but it's not one. Even people with those genetic markers aren't guaranteed to display Alzheimer's disease. So there is some genetic predisposition, but by and large, it's a very common. Whoops, sorry, I'm gonna silence this. I think it's gonna. Okay, but by and large, this is that it's just because your sister or mom had it does not mean that you are destined to get it. It's not that clear in its inheritance. Next slide. So what can we do? I mentioned don't have a stroke and mitigate those risk factors for stroke. keep learning. So learning new things, coming to a talk like this and learning something new, you know, learning how to use Zoom and maybe taking a class on YouTube, you know, trying to learn something, learning a new language, staying socially engaged, maybe getting involved in a book club, or Machong, or other, you know, like bridge club. Like there are a lot of different activities that if you engage yourself in and learn something new, can really help stave off dementia. Avoiding excessive alcohol. I've mentioned, putting in a plug, quit smoking, having regular physical activity. And you want to do that as early as possible. Midlife inactivity can increase Alzheimer's risk. So, you know, getting moving and encouraging your grandkids and sons and daughters to get moving as well can help protect them against getting Alzheimer's. Next slide. All right, so ways to age-proof your brain. I've talked about some of these. So exercising, doing some weight training, seeking out new skills, de-stress your life and mind. So maybe get into yoga or meditation, Tai Chi, eating like a Greek. That's that Mediterranean diet that people talk about. Great diet with lots of good fats and lean meats, fruits and vegetables. Finding your purpose, getting a social life and engaging socially, talking politics or current events. That is really good brain exercise. Reducing those health risks. And then on the bottom of that, checking vitamin deficiencies. It is something that can be associated with cognitive impairment, often not causative, but certainly could contribute. Next slide. So what's in the pipeline? What's the latest in the studies that they have out there? So one of the targets are targeting that tau protein that creates the tangles. So there's a vaccine that they've developed that is a vaccine against tau protein. So teaching your immune system to destroy this abnormal protein before you have the tangles forming. Now they have, thought maybe there was a question. Now they have ended this study just recently, and it did show that the vaccine was safe. Unfortunately, there wasn't a clear benefit with thinking, reasoning, and memory tests. They are looking at trialing this vaccine with other subgroups that may show benefit. So the story's not, the verdict's not out. So so that's something that we should keep an eye on. Also targeting beta amyloid. So they've done some studies with targeting the beta amyloid to see if that would help prevent some of these plaques and tangles. So far, the studies with some IV infusions that they did at WashU did not show clinical benefit. But again, I'm not certain that they're quite done with targeting perhaps earlier on in the disease process to see if it may help with other subsets of people. Next slide. And I'd be remiss without mentioning the newest that has actually been FDA approved. And this is another target on beta amyloid.
Oh, I don't know if she can hear me talk now. Maybe she can.
I see Dinah or Dina. Is it
Yeah.
Dina or Dinah?
This is Dinah. Can you hear me?
I
Yeah.
do hear you.
Oh, she.
Did- Do you have a question, Dinah?
Oh no, I kept losing you, so now I got you
Okay.
back.
Okay.
Okay. So Aduhelm. So this is the newest. Received accelerated FDA approval for treatment of Alzheimer's dementia. There's some controversy surrounding this one. There's in fact no data yet saying the drug is effective at slowing the disease progression. What is quite clear is that it does decrease the plaques that you see in Alzheimer's disease. We just don't have the data yet to say if that's going to help make life better for those patients. We've have had a number of hospital systems, because of this controversy, because of its risk, without clear benefits so far. They don't really want to be a participant in providing the treatment. So there's still, the jury's out whether or not this will be utilized much, but I really hope that we'll learn something from this aftermarket study of this particular treatment.
Is Bloom doing the infusions?
I'm sorry?
This is Dave Scher. I'm asking if Bloom is doing the infusions.
We are not doing these infusions at this time. Yeah, so it's a very small subset of patients that they're looking at possibly benefiting from this therapy. You would get it in an infusion center. There are specific criteria that you have to meet, and so far I'm hearing that neurology must be the one to monitor and order this. But again, there's a lot of controversy regarding its use because of its side effects. And again, we don't know yet if it will have clinical benefit. And the other note is that it costs $56,000 per year for the use of this drug. And that does not include the infusion center costs or costs of the PET scans and MRIs that must be done routinely to monitor your side effects from the treatment. So again, the jury's still out if this is going to be something that we'll lean on. I really hope that we'll learn something from the people that will opt for this therapy, but it's not for prime time yet. Next slide. The Alzheimer's Association and others are really encouraging people to look closer at ways of preventing the disease. And we've got a lot going on through a number of entities that to investigate prevention further. And also biomarkers for early detection. So, utilizing brain imaging, can we standardize that? Looking at proteins in cerebral spinal fluid, blood, urine tests, and perhaps genetic profiling to figure out ways of identifying people who will go on to have Alzheimer's disease, because we hope to develop more strategies to prevent the disease from developing. And then when the disease develops in those patients who have it, be able to slow the progression if we know that they have it and can utilize standardized means of monitoring our treatment effects. So there's a lot going on. And I would really encourage anyone who's interested to go to the Alzheimer's Association and check out some of the studies and different groups they're advocating for. Next slide. And there's the Alzheimer's Association phone number. They also have a website, alz.org. And then I'll also mention Trial Match, which is a way to get connected to a trial studying prevention of Alzheimer's, or for those that have it, be involved in studies to look at preventing progression. And it looks like we've got.
Okay, we're on questions. We do have, it looks like we have one question, a couple of comments and then a question from the chat, Dr. Anderson.
Okay.
All right, we've got, what are the holistic solutions for dementia? Acupuncture, Reiki, massage, etc.
Yeah, so I guess I don't have data on any of those methods, but certainly it's those strategies can be very helpful to those that are trying to deal with stress and strain from having the disease process. So those strategies, if it's helpful to help center the mind and help with stress and anxiety, I think those would be beneficial. I don't have studies to say how those different modalities affect the progression of dementia.
Thank you. Can we have this one's a comment from Lori Mittenthal. She said, FYI, I donated my mom's brain, Alzheimer's, to the Mayo Clinic in Jacksonville, Florida. I decided to do it very last minute and at her bedside while she was dying. So I ended up doing all the research on autopsies and brain banks, found a facility that would accept her brain, and found a doctor to do the brain retrieval all in the span of 24 hours. It was crazy, but I'm very grateful I did it. I'm happy to share what I learned in the process with anyone else on the call who's interested. Wow.
Wow. Yeah. I mean, what a gift. I mean, to be able to provide, help to the scientists out there that are really hopeful in trying their hardest to figure out what's going on, and to be a part of that is special. I think that's cool.
That's very cool. Are there any other questions out there before we conclude? If you have a question, go ahead and unmute yourself and ask away while we have just a couple minutes left here.
Hi, this is Cynthia Todd. I would love to get Laura.
Sorry, Cynthia, you cut out there a little bit. You might have to repeat what you asked.
Okay, Lori's comments. I'd love to get her information. If she would just put out a chat here, the information that you did find and what you did, that'd be really helpful for the rest of us. So we don't have to do it within 24 hours. Bless your heart.
We'll try to connect you two afterwards. Thank you. Anybody else?
And I'll say,
a lot
Janette
of information.
Janette made a really great comment. So those strategies, the acupuncture, Reiki, massage, those strategies might be good for the family caregivers too. And I think that's really important as a caregiver who's tasked with caring with someone with dementia. Oh gosh, it's so important to really take care of yourself. You can't be there for your loved one if you're not taking care of yourself. So making sure that your health is being attended to, and then that stress and strain and anxiety. There are also support groups through Alzheimer's Association and others that have been very helpful to my patients and their families.
We have a number of Balfour communities that have, really any Balfour community that has a memory care community is able to provide dementia day programming as well. As we emerge out of this crazy pandemic, slowly but surely, we're finding that a lot of family members who are the primary caretakers for someone that's on that dementia journey have found great value in being able to bring mom, dad, grandma, grandpa to a day program, basically, where there's some great strategies and programming that can be done with the individual to give the caregiver a break. Just, you know, it's
Right.
exhausting. Really
Right.
challenging.
No, that certainly that respite is so important.
Mhm.
And I would say too, you know, trying to enrich your loved one's life by those kind of programs is really great too. So it's really a win-win, you know, if you can do that, for sure.
Dr. Anderson, do you know of any nutrition sites, websites that could perhaps provide some guidance for those with dementia?
Yeah, you know, I know the Alzheimer's Association does have some guidance on diet and nutrition, so that I would refer folks there. WebMD also is an online resource that may give some guidance on just overall healthy diets that may help not only Alzheimer's type dementia, but other health conditions as well.
That's great. What aspects of the day program activities for those with dementia are implemented within the Balfour residences? Maybe there's somebody, is Carrie Gray still on the call?
I am.
Yay, Carrie. Carrie's one of our pro leasing counselors. She guides a whole lot of families through this thing called senior living and has a special place in her heart when it comes to dementia and Parkinson's. Lewy body, you know, in her family, she lost her grandfather recently to Lewy body and Parkinson's. So this is a topic near and dear to her heart, and she also provides counseling for others. So go ahead, Carrie.
Yeah, I think one of the things that is most important is to give relief for the caregiver in any sort of aspect of senior living, right? Whether it's day program or full-time placement, whatever that choice is, the delicate choice that it is. But even things like really sound meals, healthful meals, and constant activity throughout the day, so that if it is a day program situation, or if it is a full placement situation, or even if it's something that you're experiencing at home, just trying to encourage daytime activity so that you can lessen some of our circadian rhythms that we have when we're not active during the day. And I think that is something that's important for caregivers or for us at Balfour to keep in mind and keep as top priority.
That's great. I see Natalie's on as well. Natalie Hallett from our Riverfront Park community. Natalie, would you add anything about, hi Natalie, anything else that you would add about what you've seen about with dementia day programming?
We haven't done a lot of day program just based on our availability, but I think a lot of us have mutual experiences. I know my grandmother was diagnosed with Alzheimer's, and this was many years ago. And you know, there wasn't a community like the Balfours out there for her. So prideful for me to be working for such a great company and have those resources, have the care levels that we do, to really be able to meet people where they're at. It's so important. So
that's great. I see Laura came on. I know she's got some stories to tell, great stories to tell about Dementia Day program over at Central Park, Denver.
Absolutely. We really look at a variety of activities in our programming, whether it be music therapy. I think music therapy is the one thing that really everyone can connect to, even someone who is very advanced in their disease. So we definitely utilize music therapy. We look at physical strengthening, balance. We have our occupational physical therapy staff doing specialized exercise, step-by-step guided exercise seated programs with our residents. We do cognitive stimulation, even using something like a tactile stimulation to maybe help connect to a memory from the past, getting people together, peers to socialize. There's truly a variety of things that we offer our residents to help.
It's great. I think it's one of our best kept secrets at Balfour that we are able to offer that service. It's pretty great for families and for individuals. So thanks, Laura. Okay, anything else?
Yes, I have a quick question, and that our father, who's in the Longmont facility, will not participate in much. I mean, anything to do with food, yes, but the socializations, the things that would expand him, he's just saying no. And a lot of it has to do because he's so hard of hearing. So any suggestions there?
That's hard. Are you looking for suggestions, Cynthia? Is that what you're asking?
I am. I'm looking for suggestions on how to get him more involved. And I know the staff is being great and they try and bring him in, but you know, if you keep saying no, there's not a whole lot anybody can do. So
Cynthia, hi, this is Janette Allen. I'm the Vice President of Health and Wellness. Has your dad ever worn hearing aids, or is that not something he's amenable to right now?
He does have hearing aids. They're often plugged up or dead batteries, but we keep trying to make sure that he's.
We need to work on that so that his hearing aid batteries are all charged up. So I'll get with Julie and Mary at Longmont and make sure that your dad, because I have to tell you, the hearing loss, I have a mother who's also suffering with hearing loss and some mild cognitive issues. It is very isolating and it makes the dementia look worse. So that is something we're working on. And I partner with, Balfour partners with an organization called Eversound. And for people who don't want to wear their hearing aids, we can actually use the headphones from Eversound with the amplifier to help those residents who don't want to wear hearing aids all day to enjoy a program. So I will find out from Julie and Mary who your dad is. It will.
Great. And if he happens to need if they were recommending new hearing aids, that would be okay too.
Yep.
Can I just step in, Carrie, from
please
somebody that loves Longmont and the amazing team.
Tell me more, Carrie.
At Longmont. So for your dad, I would encourage any sort of visual aids that he also enjoys, whether it's outside time or if there are, and let's step away from the TV because that could be frustrating. But anything else that he enjoyed in his past or a career or anything tactile that he might enjoy that we can express with our team in Longmont to make sure he's fulfilling those needs as well, to help him feel.
Thank you, Carrie.
So anything visual, if there was anything that he loved to see, any outside walks or anything that our team at Longmont can do to help encourage that mental stimulation, let's bring it up and talk about it and make sure he's fulfilled.
Thank you, Carrie. I will reach out to you privately for more of that. Thank you so much.
Yeah, I love that. I love those ideas, Carrie, and I don't know if this would speak to your dad, Cynthia, but sometimes putting together a photo album so that we can ask about, like, oh yeah, so some pictures of maybe places that he's gone, or family vacations that were very special. That's sometimes a way to, but I can understand like that social interaction may be very difficult because of, because of the hearing problems, might cause frustration when you can't communicate. Janette, I love that idea of let's try to get the hearing aids. And if hearing aids aren't an option, then maybe the other amplifiers. Great idea.
We have to have really good processes internally to make sure those hearing aids are charged. However, a lot of times with residents living with dementia, they really don't like those devices in their ears. So Eversound technology is another option for those periods when we do want to help them engage.
Yeah, and I would say having a hearing problem not only makes the dementia look worse, but it also decreases your ability to engage and can create a situation where you're less social and you're less engaged, and then you're more at risk for having it be worse. And so whatever we can do to get people more engaged, the better off they'll be. So.
Well, I can't believe how fast this hour has gone. We're a little bit over time. I just want to say thank you to everybody, Dr. Anderson, Janette, Carrie, Kim from Synergy, and Claire, if she's still on here too. I mean, thank you everyone for circling the wagons and providing support for this community of ours. Thank you to the participants that have come in here today and have shared a little bit of yourselves, and I hope that you learned something today as well. And please do stay in touch with us. We continue to have these sorts of get-togethers to just educate. I mean, it's pure and simple. Just educate each other. Get used to using that word D that starts with a D. Try to reduce some of the stigma associated with dementia, so that we can all just get back to just living the best lives that we can. Right.
And Lori Mittenhall, thank you so much for sharing your story and putting your email out there to share with other families. That's really special. Thank you, Louise and team.
Yes. And Laura, anything in closing?
I just wanted to say a huge thank you to you, Louise, for helping throughout this webinar, and to Dr. Anderson, thank you. I learned an incredible amount and really appreciate all the time that you put into doing this, and thank you so much for everyone in their participation.
Awesome. And we will, once I get this recording loaded up, we'll have it available to share, and our various listening counselors will reach out to you and share the recording with you so that you can review it again with others and share with others. Please share.
And can I say one more thing?
Sure.
I would just like to share the accessibility of our team. If anybody needs extra help or support, there is a village that surrounds you.
Yep.
So, Louise, if you could please share.
Share my information, share Carrie's.
Yes.
Yep. There's even a dementia support group out at our Balfour at Cherrywood Village community. So that has been ongoing. I believe, I can't remember what the cycle is, but once a month, I believe that they are gathering. So, we're all about strengthening our community together, right? So what our communities need, we present these kinds of webinars so that we get a feel for what people want to know and what they need to hear, what they want to learn. And then we go find fabulous people like Dr. Anderson who can then deliver the message and educate us all. So thank you very, very much, everybody.
And thanks to those that hung in there with us past the 5 o'clock hour. We appreciate you very much.
Have a wonderful evening.
We appreciate all of you. Thank you, Dr. Anderson, so much.
Thanks for having me. All right. Take care, everybody.
Thank you, everyone.
Bye.
Bye. Thank you.